Greetings and welcome to another edition of Montpelier Connection. I'm State Representative Mike Mrowicki from the Windham 4 District of Putney, Dummerston, Westminster. We're here ready to start the 2016 legislative session, and today's guest is Senator Becca Balint.
Good afternoon, Mike.
Welcome.
Thank you.
And Happy New Year to you.
Happy New Year.
Just like Happy New Year to everyone there watching at home. We have a lot before us, as we always do in our compressed 16-week, 4-month session. Before we get going on next year, there's some things we need to take care of from last year. One of them is a House bill that we passed and sent over to the Senate, and I think it's something that's pretty important to you.
That's right. I think you're referring to the earned sick time bill, and it was something I was really hoping would come to a vote on the floor. I know that there were quite a few concerns that some smaller employers had, and as many of you know, vast majority of our employers in Vermont are small and medium-sized employers. And so there are a few key issues I know that we were trying to hammer out in the Senate, and so it did not come for a vote. One of those being, if employers had already leave time in place in their benefits package, they want to make sure that if it was equal or exceeded the proposal for the bill, that it would not be touched. Yeah. The other was this issue of it being earned sick time. And I know for me personally, I was a little sad when some of the folks who have been really advocating for this bill changed their talking about it from earned sick time to paid sick leave. And for me, I think it's really important that people understand that it's a benefit that is earned over time, and that is not, day one you do start accruing the time, but you have to be on the job 1,400 hours or a year, whichever comes first, and that's really a good amount of time for an employer have to decide if they've vetted the employee to make sure that they're committed to the work. And so, if at that time they've shown themselves to be a committed, dedicated worker, this is a critical benefit for so many working families in Vermont. And as you know, here in Windham County, we have quite a few families in poverty, quite a few single-headed households, many of them women. So it is important to me, not just as a working mom, but also as someone who was an educator for many years. We know that many parents feel like they have to send their kids to school sick, and that impacts the learning environment for everyone.
The whole class.
The whole class and the teachers, and no parent wants to send their kid to school sick, and if they don't have that benefit in their employer, the place of employment, then they have some very terrible choices in front of them. Yeah.
So there are some concerns
Yep.
from smaller businesses.
Yep.
Some, as you said, are already doing this and wonder how it affects them. Does this hurt business? Does this help business?
Yeah, there are only a few states that have it in place, but the initial data that we have seems to imply that employers are not harmed by it for many reasons. You have a more dedicated workforce. People feel like they have a partnership with their employer that really takes into account the needs of working families, and nobody wants to choose between work and taking care of a sick kid.
Or a parent.
Or a parent, absolutely.
Yeah.
That's in the mix as well. And I feel like it could have a boost to the economic landscape in Windham County in particular, which of course the lens I look through, which is we have one of the oldest, demographically oldest counties in the state. We're having a hard time attracting workers. To have this kind of benefit that we can talk about outside of the state, I think will be more attractive to young families. Yeah. And so I'm always hesitant to say that it will be an economic boon to employers. For me, I'm looking at the whole picture, which is that we want them to have employees who are dedicated and committed and that will continue to stay on the job. The other piece of that, I think, that's important to remember is we have an incredibly low unemployment rate. And so you've got employers that need to find a way to keep people invested in the jobs that they have, and I think this may be a good tool to do that.
Back during World War II, I think the idea of benefits is one of the ways that health insurance got going.
Absolutely.
It was, I believe, there were wage freezes then. So employers were kind of pressed to figure out how can we make our jobs more attractive,
Right.
and that's where the idea of health insurance started.
Yeah, and I think that is one of the things that we heard from some employers on the Senate side was they felt that this is a tool that we use to set ourselves apart from each other. So it makes them uncomfortable to feel like we are impacting the relationship between employer and employee. And I'm sympathetic to that. I understand that they want to be able to differentiate themselves.
Sure.
However, I feel like there's a lot of wiggle room in this bill for them to continue doing what they're doing. We're just saying we want a floor. We want a baseline benefit. We know that we have so many working families in Vermont that would benefit from this, and that is better for the economy. You don't want people missing work days because of sickness or having to take care of a relative.
National Public Radio had a feature on this last week, and what they were talking about is there are a lot of larger corporations that are leading the way now.
Yes.
But how it affects small businesses, which are the majority of businesses in Vermont, is another thing. So I think it sounds like we're moving cautiously in a prudent way, but in a way that will make progress.
I think, too, one of the things that gets lost also when we talk about small and medium-sized employers in Vermont is many of those are our small nonprofits.
Yeah.
And I actually had a conversation with the head of a nonprofit who's very socially engaged and committed, and he believes in it. And privately he told me, I'm also a little worried about how this will impact our bottom line. But he said, but obviously, I believe in this, and so we're going to make it work. But I do know there are going to be some kinks that need to get worked out for sure.
I think it makes us all stretch a little too.
Yeah.
And I'm not sure that's a bad thing.
No, not at all.
You know, when we look at how it is in other countries, the benefit packages in this country look pretty pathetic.
Especially when you're looking at any sort of time off.
Yeah.
I certainly have numerous friends for whom they have jobs that ostensibly give them time off, but they never take their time off because they feel like they're not able to step away from their work.
Yep.
Yeah.
Now, Senator White, and we talked about this last month, also has a bill coming forward, and has to do with creating the new position of a mid-level dental practitioner. That's going over to us in the House.
Right.
I've been told by our chair in House Human Services, Representative Ann Pugh, we are going to take that up. Hopefully we can get that moving. When you were voting on that in the Senate, what was the kind of pushback you heard about that?
A couple different things people brought up. They were concerned that they might not have the level of training that was required to deal with serious situations that might arise in the dental chair. Now, obviously, the important part to remember is no dentist is going to take on, because you basically need a kind of apprenticeship model at first, and then they're working under the tutelage and the supervision of a dentist. And so it's not as if they're working on their own. There's always going to be somebody there to step in when, because we all know sometimes with medical situations, you think it's one thing, you get in, it's much more complicated. But I think it's a little bit of a red herring to say that that is a reason not to do it. We've got this in place already, I believe, in Minnesota, very successful there. We have so many Vermonters, that do not have access to dental care. Yeah. Whenever they do the free clinics here in Windham County, and I'm sure it's true around the state, the line is out the door. Yeah. People are forgoing critical dental treatment because they don't have access. So I feel like it's a really important step.
Yeah, and what we know now about the connection between our overall health and dental health makes it even more important that this is something that gets neglected, and it impacts our entire health.
Yeah, it impacts our emotional health, our well-being. When you're tolerating pain for an extended period of time, it plays into your work performance, your performance with your family as well. Yeah. What's the landscape look like in the House? I know that it wasn't taken off the wall, I don't think. Last year, you didn't discuss it at all in committee, is that right?
We did take a look at it a little bit. We heard quite a bit from the Dental Society.
Okay, yes.
And we didn't feel like we had enough time to give it all that it needed. There's a companion bill that another House Human Services Committee member has had for a few years. So there's a strong impetus in our committee to get this bill
Yeah.
and move it. So I think we're going to vote it out and hopefully get it to the floor soon and get it in place.
One of the things that I heard from the when in researching this bill and seeing what it was done, again, I believe it's Minnesota. I hope I'm not misspeaking, but that
I think Minnesota and Alaska.
And Alaska. That dentists were so thrilled to have the opportunity to take on these mid-level dental care providers, that some had started with one and then took another one on so that they could broaden their practice socioeconomically and make sure that people had access to dental care, especially for children.
Yeah.
You know, so.
Yeah. And moving ahead,
Yeah.
By the time this program airs, we will have started our session. And I think, as should be, we'll be hitting the ground running. Your two committees this year are?
Economic Development and the Institutions Committee.
Yeah.
And I know that one of the things that we'll continue to talk about in institutions is the ongoing issue around IT.
Yep.
And expenses, not just upfront expenses of IT, but ongoing support and how much each of those programs take to continue to upgrade, make sure people are trained, make sure we have the right hardware and software. And there is, I think, a lot of interest, at least there was before we let out for the summer, to really have a committee that is specifically designated to look at these projects. Because I know those of us on Senate institutions often felt just in over our heads.
Yeah.
We didn't have the breadth and depth of knowledge that we needed to make good decisions around IT. And I think given the ongoing struggles of Vermont Health Connect, none of us want to see that happen again. We all want to make sure that whatever IT project that we're investing money in is really going to work for Vermonters. So I'm curious about that.
We do have systems that work really well, though.
Yes,
now,
we do.
Any medical provider that bills will tell you Vermont Medicaid pays usually within a week or so. Mm-hmm. Whereas with private insurers, you measure the time in months.
Got it.
So we do have systems, and there's a, we've worked in conjunction with a large provider, and I won't say the name, just the initials are HP. They do a great job.
Yeah.
So we have systems that work. I think it behooves us to look at what works and see if we can replicate that.
Absolutely, and I think it's going to be important for us too to acknowledge that we are a citizen legislature, and things have gotten incredibly complicated in terms of the IT support that's needed. And so Senator Mazza and I sit on institutions, and I don't think he would be shy if I said this, because I'm sure he said it on the record a number of times, which is, why can't we just go back to paper and pencil? He's like, it was all so much easier when we could do paper and pencil. The problem with that is that Vermonters demand more.
Yeah.
They want to make sure that whatever paper that they're filing, whether it's in the court system or DMV, or whether it is about taking care of a ticket, whatever it might be, they want to make sure pretty much that it's happening in real time. So we're all part of that, of making sure that the customer service is very, that the standard is very high for that.
We had Secretary of State Jim Condos when he was in town. He took some time to talk with us and talked about all that he has on his website. Again, I think this is something that's it's
he's made some really great changes.
He really has, and as we look forward to more transparency, especially in regards to campaigns, campaign funding, that information is going to be there, and I think Vermonters want that.
I think they do want that, and I think that we can deliver a good product.
Yeah.
We just need to have, speaking of systems, we need to have a better system, I think, in the legislature for really gauging what programs are working, why are they working, what supports were in place for them to be successful, so that we are following those models.
Yeah, you bet, economic development.
So I was very excited to be able to go to the ribbing and cutting, I saw you there, at GS Precision here in Brattleboro. It was a long time in the making. Really, the impetus for that deal or rather I should say, where that deal was first incubated was in the conference committee on economic development, which was to give the governor a little bit more leeway in terms of the enterprise funds. And that really got the ball rolling in terms of looking at who are some of the critical employers around the state. And here in Windham County, GS Precision is one of those critical employers. Not just because of its commitment to the town, okay, in terms of all of the ancillary support that a town gets from having high-skilled workers, but it's really critical to the whole labor shed. So we know that there are workers that come from Wilmington, some from Keene, some far up the Route 30 corridor. And so when it was first, it came to light that they may move to New Hampshire, this is would have been a very serious blow for Brattleboro. Now, GS Precision has also led the way in figuring out some really interesting training models in terms of how do you, if you don't have the workers that you need, how can you do more on-the-job training? And so they've set up this really incredible school there to train.
Right on their campus.
Right on the campus.
Yeah.
And in many ways, I think it can be a model for other employers. So I am thrilled that they're staying here. It was, as I think Patrick Leahy said, it was great Christmas news for all of us. And heading into the new year, I feel really excited, not just for GS Precision, but what that means that we have as a town said, we're going to make this work, that we believe that these are good jobs, that we support the work that is done there, and we want to see more of this. And you and I have talked about this before, which is it's very difficult to attract big new businesses here for lots of reasons. You know, we don't have a big airport in southern Vermont. We can get into some of those other details, some of them the workforce that we have challenges there. So we have to grow the ones we have. And so this is a great example of a business that's been doing well consistently for a long time and giving them the boost that they need to expand. And it was wonderful to be there to see Secretary Moulton there and have her and
well, to hear the story of the Schneeberger family and the Moulton family. This is second generation
exactly.
now.
It's second generation.
The father's starting this.
Exactly.
And here's the Schneeberger family continuing.
Exactly.
And Pat Moulton continuing to help provide the jobs here in Windham County. And
I loved that at different points in the ceremony, both Secretary Moulton and Kate O'Connor, people referred to them as some of the best champions for state of Vermont, for Windham County. That's what we really need. I mean, we really need to be championing what it is that we do well here and not being shy about deeply loving our state.
Yeah. And that carries over into another area. Yeah. The last administration I worked under, I felt could have done a lot better job doing that, and yet what we heard from them over and over again was how bad Vermont was for business. Not a great place to live. Mm-hmm. What we found out, because this administration now has been a great champion for business, and hats off to the governor, as he said, when he heard there was a prospect of GSP leaving, he jumped in his car and headed down with Pat Moulton to see, we got to do something.
I want to touch on something you just said because I think it's critical in this conversation, which is the housing piece. Mm-hmm. A friend of mine who does economic development work and research in Western Massachusetts, she and I had a phone conversation the other day, and she said, when we think about economic development and a healthy economy, oftentimes we think about housing as a commodity. And she said, we're thinking about it all wrong. We can't think about it as a commodity. We have to think about it as investment in the community, investment in families, investment in employees, essentially. And so we know from the Vermont CEDS that was written, so the Comprehensive Economic Development Strategy that was written for Vermont, the Southeastern Vermont CEDS, and the most recently published Economic Development Zone Report for Southern Vermont, they all say the same thing. Relationship to housing. We don't have enough adequate and appropriate housing for the workers that we have. Yeah. And so it's not only difficult for those families because they're They're priced out. But it's geographic issues. They don't have employment that is close to where they live. And the other piece is the trailing spouse piece. Okay, so that you need a house that is not, or an apartment or situation that's not just appealing to you, but whoever you might be bringing along. So you basically have to convince two people that it's quality housing. Our housing stock is old. A lot of it. I live in an old house here in Brattleboro. We did as much energy efficiency work on it as we could. But that also makes it somewhat unattractive for young families coming in if they know they're going to have to do a lot of upgrades to make it more energy efficient. So I would really like to see a broader discussion within the state about looking at housing issues and how they're integrally connected to the economy.
Yeah, I totally agree. And here I'm going to give another shout out because the local housing trust, Connie Snow and the people at the Windham Windsor Housing Trust, we wouldn't be having affordable housing if it weren't for them.
Yeah.
I'm on the Affordable Housing Committee in Putney.
Yeah.
We just heard of
we have a new project going in there. I know, I read
like
that this
21
morning.
units. We really need this.
Yeah.
So thanks to them. But that connection to economic development is as critical as any other barrier or asset to that. So.
And I think, too, we sometimes have a really hard time with the tension between leaving, open space or leaving historic buildings in place or developing new, more energy efficient housing.
We have one of the lowest uninsured rates.
Yes.
We can do some better work around that, though, because a lot of people have health insurance, and basically it's catastrophic insurance.
Yes.
So when somebody gets sick, the bills come in fast and furious, and I believe that healthcare costs are still the number one reason for personal bankruptcies in this country. Ideas for what we can do in healthcare.
So I was contacted in the summer by Peter Sterling, who had been heading up one of the advocacy organizations who had been pushing for the single payer program. And he had been doing a bunch of work behind the scenes to figure out how else can we get creative about getting more people covered for less money. And they're really interested in decoupling family plans from employer-sponsored health insurance programs. So they rolled out this Dr. Dinosaur 2.0. And I'm excited about the possibility of, so we're going very slowly on this. So what we want is a study. We just want the legislature to pass the bill that would allow money to be spent on the study. And really what we're looking at, let me make sure, we want to know.
Can we just take a step backwards here?
Yeah, please.
Let's go to Dr. Dinosaur 101.
Yeah.
Our children's health program.
Yeah, our children's health program is highly successful.
Yeah, so every child has coverage.
That's right. And so what we're looking at with 2.0 is every child being able to opt in up until the age of 26. So which would essentially, if your family opted into that, you then would not have to be paying a very big premium on your employer-sponsored health insurance program. It is a really exciting possibility. I know, thinking about my own experience with healthcare, so I'm asthmatic. I take several medications to manage my asthma. And there were years when, after I graduated from college and before I found full-time work, that had health benefits that I was not covered. And I could not afford my medication. So I came from a middle-class family, and my parents could help me out when they could. But there were many times when I was in distress in my early 20s when I did not go to the doctor. And then I waited until I needed acute care, which is not what we want.
Right.
We don't want that. So if we can get this study passed, which I think we will be able to, they've done a great job of reaching out to Senator Kitchell, the Senate side, and also Claire Eyre, Senator Eyre, in really thinking about, could this be the next step in trying to rein in healthcare costs? And make families feel more secure in the insurance that they have. So I know I have a very high deductible on our family plan.
Yeah.
And so we always laugh when we go to pick up our medications. We hit our deductible around the third week in December, and then it starts all over again January 1. So it's very difficult for families.
Well, I think there's going to be some traction in the House, and unfortunately, our Speaker has learned about this firsthand. Many of you might know our Speaker, Shap Smith. His wife has been diagnosed with breast cancer, and they are running into this wall themselves.
Yeah.
And Shap's a lawyer, his wife's a doctor. It's not like they don't have good insurance, but what they're running up against is insurance is convoluted the way
it's very difficult to understand.
It is, and I think it's given him a different perspective, and I think this is an idea as a lot of our kids get older too, that we can expand, because the idea in the long run saves us money, and it saves pain and suffering too from people who would wait.
Yeah, that's what we do. We wait, and that is, it's not unique to Vermont, but there's a stoic streak that we have here in this state, and I see a lot of seniors, and I see a lot of people who live on the margins just forgoing it, and it's this sense of, no, I can manage this. We don't want people to be managing chronic pain on their own. We don't want people to forgo, as we talked about earlier, the dental piece. That can turn into much more serious problems than just a cavity that's gone untreated. So we know that the model for insurance and for covering people and families needs to change. So the fee-for-service hasn't worked. The all-payer model, it will be interesting to see if we're able to implement this system where money is allocated to the provider, and then they have to have a much more holistic approach of how they're treating patients. That is what we need to head towards. Of course, the danger comes in of what if we're not seeing the returns that we think that we will.
And this happened years ago with HMOs. Yeah. Initially, the first few years, we saw the outcomes that we wanted to, and then it started to bend the other way, and so what do we do next? So, well, we're about out of time.
Oh my gosh, that went so fast.
A half hour goes well. About these issues and anything else, if people want to get in touch with you, what's the best way to do that?
Sure, call me at home, 802-257-4162, or email me at my legislative address, which is bbalint, B-A-L-I-N-T, at ledge.state.vt.us. Yeah. Thanks, Mike.
And that information is on the legislative website as well. And we do want to hear from you. As the session unfolds, we want to hear from you. We want to hear your suggestions, your comments, what we could do better or more of. It's essential for democracy to work, for us to be able to be the conduit for your ideas and bring them to the legislature. And I think it works well in Vermont because of that. Well, thank you for taking the time.
Thank you, Mike. I appreciate it. Happy New Year.
Yeah, Happy New Year to you. Again, thanks to all the good people here at BCTV for helping bring our work closer to you here at home. We'll be continuing these broadcasts in a little different venue as we have in the past. We'll be doing some broadcasts from the State House. So hopefully we can keep you updated on what's happening. And until that time, thank you for taking the time to listen to us. And I'm Mike Mrowicki from Putney. Take care. Bye-bye.